good morning or good afternoon or good evening. It, of course, depends on your location. I'm located in Krakow, Poland. I'm a bioethicist with a background in philosophy, and I work at Jagiellonian University Medical College at the Department of Philosophy and Bioethics. And today I would like to talk with you about two things. So the first topic is pandemic in a libertarian state. So what kind of public health safety measures can we ethically justify based on a very limited ethical assumptions that are accepted by libertarians? And the second topic, which I hope we also manage to discuss, is internet research ethics, but from a point of view of a bioethicist. So someone who comes to internet research from, let's say, purely biomedical or bioethical background and wants to use internet as a tool to collect data. So what is new in this kind of environment or in ethical framework for internet research from the point of view of a bioethicist? I have to admit that I prepared two very long presentations, and only this morning I realized that I don't have 3 hours, I have only 2 hours. So that's why I shortened my second presentation, but I would like to give you access to both, to the shorter version and to extended version. If you have any further questions, you can email me, and I can also share with you some of my thoughts and materials. So let's get started with pandemic in the libertarian state. And first, I would like to discuss a few general concepts. So the concept of the libertarian state and the concept of public health and public health intervention. But first, let me start from a short, let's say, brainstorm. I just want to know what are your association when you think about individual liberty and public health measures such as face mask, vaccination passport, social distancing. Do you think that this kind of policies really affect individual liberty, or it's worthy to let's say to sacrifice your liberty to in order to protect others? What are your thoughts in this regard?
Hi, I will start. I think that really we need to look at it from the perspective of where we are, particularly with the pandemic. And in the early stages, when there was so much unknown and such a high rate, I think that the mandates at that point were certainly more tolerable and acceptable, both from a legal perspective and from an ethical perspective. But as it lingered on and continued, the pendulum began to swing a little bit more. Particularly, and I'm going to point it out, and with all disclosure, I just did a paper on it, that particularly, for example, I'm in Florida in the United States, and the mandates as applied to the elderly, the older adults living in long-term care, et cetera, were so significant. And now we're seeing, the fallout of that from the profound social isolation. And, how far does it go? But when you're getting into mask wearing, I happen to be in a community where there was such a huge outrage over the mask mandates and the claim of individual liberty. I think when it's something so, easy as wearing a mask, I don't see that as really imposing on the individual liberty. You're doing it for the protection of everyone, hence including yourself.
Mm-hmm. Yeah, thank you. So there are, let's say, different things that you mentioned. On the one hand is, let's say, burden on your on individual let's say well-being and everyday functioning. Then is the level of risk. So what is the stage of the pandemic, and what is the long term, let's say, consequence of a certain policy? So every
it's balancing.
Everything should be balanced when we talk about this kind of public health measures. Any other voice about this?
I think
Yes,
I will
please.
echo Kathy's statements as well. I think from my perspective, I'm in Canada, in Ontario. We just got out of our third wave. We've been through lockdowns. Our children have been out of school for,
Mhm,
it has been 6.5 months
mhm,
cumulatively. It's been a long haul, but I think there was a lot more support for the lockdowns and the measures and the masking and that sort of thing when it was more unknown, like Kathy had mentioned, when people didn't know how the virus spread and those sorts of things. And I know hindsight is 2020, but I feel that had health been prioritized earlier on and lockdowns being executed more stringently, we maybe could have avoided a third wave of
mhm,
the virus. So I think it's balancing as well, but I think also that if we had just hard lockdown like we've seen in Australia, um, where they go down to lockdowns with 5 kilometer radius, that's all you're able to go. They've been very successful in curbing the virus through those measures that are quite strict but short-lived. So I think it's balancing, but if you do impose more strict measures, that it needs to be short-lived because there are definitely health ramifications for it extending beyond a short amount of time.
mhm. Thank you. I see that also Lucy Turner wants to say something. Please go ahead.
Yeah, I was just going to say, it's interesting from a health professional background where every day in your job you're expected to mask for regular procedures, to wash your hands all the time,
Mhm,
to be very careful with patients, mainly not because of yourself, but because you have a duty of care to protect those patients. So
mhm,
you would never think, oh my gosh, I don't want to wear a mask because of X, Y, and Z. You would think, I'm protecting my patients, I'm wearing my mask to avoid giving them any infections that they wouldn't be able to deal with, and that's very much part of the job when you're a physician or a nurse or anything like that. So it's been quite interesting. And similarly with vaccines, we in the UK, we have to have all of our immunizations checked. We have to have the hepatitis B vaccine before we start work. All of these things that the regular population is kind of finding very, very difficult to manage is a part of our everyday careers. So it's just quite interesting from our kind of collective, I shouldn't really say our because I can only speak for myself, but from that kind of collective experience of thinking,
mhm,
I don't really understand why, when so many of my colleagues have been risking themselves every single day, taking risks of their own health and making sure that they protect others, it's hard to understand the other like Kathy mentioned, the absolute outrage about masks when we have to protect each other to protect ourselves. So yeah, just coming from that different perspective, it's just been interesting.
mhm. Yeah. So this is also very important what you said, because on the one hand, we can try to balance, let's say, the burden for individual and beneficence for the whole population or for the whole country. But on the other hand, you are talking about even a different dimension about moral duties that we have towards others. And sometimes we have these duties because we play a certain role, and we are, for instance, a healthcare professional. And healthcare professional, uh, first and foremost, should not be a threat to his or her patients, and that's why that person should take special precautions in order not to infect his or her patient. So this moral duty is also, let's say, rooted in your professional identity, in your professional role. Mhm. Any other comment about individual liberty and public health measures and interventions?
Yeah, I just wanted to add that in considering what public health interventions to incorporate, I think it's also important to consider how many resources are available. So I live in like kind of around New York City, and I know that it was like very bad here at one point where there weren't enough hospital beds for COVID patients, like there weren't enough ventilators. There was just an extreme lack of resources. So I think in an extreme scenario like that, like you need to be very strict with these measures because you can't really afford more cases. Whereas in other cases where there would be more resources available, like all other things staying the same, I think that like it would make more sense to value individual liberty. But in cases where you really don't have a lot of resources, I think that should also be considered in addition to things like what stage of the pandemic you're in.
Yes, this is also quite interesting perspective, because usually when we talk about emergency medicine or catastrophic medicine, we have to also take into consideration that our, let's say, natural moral intuitions can be somehow suspended, and like in everyday life we are able to protect and respect individual rights and individual liberties, but there are also times of moral catastrophes where we are somehow, where normal ethics is somehow suspended, and we do some extreme things in order also to avoid extreme consequences. So when we talk about New York, everyone can have this association with Twin Towers and can think about this thought experiment and for a long time very abstract situation that you have to take down a plane full of passengers in order to, let's say, save people who are in a building that a plane is going to crash into. So some ethicists would say that there are some extraordinary circumstances in which we suspend our normal, natural moral intuitions, and that's why we are ready to really sacrifice individual life, individual liberties for the greater good. Okay. So let me jump to another question. Let's try to define right now the concept of public health. When you hear the term public health, what comes to your mind?
I can take a guess. My sister's going to be so disappointed. She's doing her master's in public health, so she'll be horrified that I didn't have a quicker response. But my understanding is that public health is sort of the art of or science of preventing disease, mitigating risks within a specific population.
Yes. Any other thought?
I agree. I think it can be as basic as, sanitation and clean water and those sorts of things, or as complex as vaccine rollouts and, sexually transmitted disease education and things like that. So it can be sort of a basic need, or it can sort of extend to other things that incorporate health, but maybe are not so directly related to health. Some things that come to mind are, sex education for children in schools. It's more preventative and educational than it is a direct, necessarily a direct impact on your health indicators in the now, but it will hopefully encourage health on an ongoing basis. So I think there's some present work in public health, but there's also lots of groundwork for future health implications in public health.
Yes, that's true. Thank you. And someone else want to add something? Yes, please.
Yeah, I agree. It's definitely a preventative practice in public health to prevent, like we are the practitioners to prevent populations from ending up in the hospital or worse. So we're the ones that sort of are physicians over a population versus a physician who takes care of one patient at a time.
Exactly. So generally, when we talk about the meaning of public in the concept of public health, we can thought about, let's say, three different dimensions of public health. So on the one hand, we have aggregation. So what is characteristic of a certain population as a whole? So what is mortality, morbidity in a certain population. We are not talking about individuals, but the means for the whole population. But on the other hand, we can also think about distribution of this characteristic in such population. So if we compare two different groups of people, we would say that this one is healthier, where the distribution of a certain health indicator is much more even, or is much more equal. So let's say two populations can have the same means, but in one population only a small portion of people, for instance, have a very long life expectancy, but majority have a very short life expectancy. Then we would say that this population, from the public health point of view, is less healthy than the population where the same health indicator is distributed in a more equal, even way. And the third dimension of public health is actually infrastructure that keeps us safe and prevents public health threats from appearing. So let's say if we have two perfectly healthy populations, that one is, let's say, more healthier, which is prepared for a possible pandemic, where there are stocks of PPE, where there are special procedures, where there are healthcare institutions, and where people are, where people have healthcare insurance. Another aspect of public health is what you also mentioned. So it's like this famous three Ps. So prevention, protection, and promotion. I will not discuss the details because I think that they are quite obvious. But what I want to focus is characteristic of public health intervention. And when we talk about public health intervention, we have to take into consideration three different aspects. So public health intervention is usually performed by governmental authorities. Its goal is public health. So it is not performed because of the best interest of individuals, and certainly not of certain individuals, but it aims at this, let's say, group indicators. And also it usually involves the whole population. So everyone has to be involved. If there is, let's say, no smoking policy, then everyone is prohibited from smoking. When we talk about mandatory masking, then everyone has to wear a mask. And the third aspect, which is also very important when we talk about public health, is possible coercion. So when someone doesn't want to follow the policy which is promoted or introduced by the government has a special means of coercion and can actually coerce individuals to follow certain policy. So if you don't want to vaccinate your children, you cannot send these children to school, and you have to pay a certain fine. So this three different aspects of the governmental authorities, global goal of public health, and possible coercion has to be taken into consideration. So let's now try to think about libertarian state. When you hear the name libertarianism or libertarian state, what comes to your mind? How would you define a libertarian state?
I think freedom, public freedom. Freedom to choose.
Do you want to live in a libertarian state, or is rather not so encouraging, let's say?
I think, honestly, I think liberty at all costs. That's how what I think.
That's interesting how you put it. Liberty at all costs. Julian?
I would add that it's a very particular conception of liberty rooted in like Enlightenment liberal thought, and so that gives it a tendency to prioritize the right to like not have other people aggress on you, and the right to property above all other things. So it's not necessarily liberty in the sense that most people would think about it. And I'm assuming we're just talking about right-wing libertarian states here.
Yeah, that's true. That we can discuss about left-wing libertarianism or right-wing libertarianism. In general, there is no one libertarianism. There is a whole bunch of different libertarian theories, but there are some libertarian principles that I think that all libertarian philosophies share, and I will try to define them. So generally, as you already mentioned, when we talk about libertarian philosophy, we think about prizing and putting stress on individual consent. So whatever happens to me, I have to give my consent, and also I have a right to consent also to things that are harmful to myself, and no one has a right to stop me. And there is also this conception of self-ownership. So I'm my own owner, and that's why I can dispose myself whatever I please, however I please. Also, I have in libertarian theory, my personal rights are very seriously taken, and this principle of respect for autonomy is very important. And on the other hand, when we talk about the state power is very limited, and it is thought that state is not engaged in any kind of redistribution, except probably redistribution of protective services. So the state just provides all its citizens with police and justice departments. And generally, libertarians do not sacrifice any interests of individual for the sake of the whole group, so of the whole society. So when we talk about public health and public health policies in the libertarian state, we can only talk about these policies which are not justified by the concept of greater good, the concept of public interest, the concept of common good, and the concept of utilitarian calculus. When we are talking about this public health interventions, you quite often refer to greater good, to public interest, and to the cost of benefits, and try to balancing these different costs. So a libertarian person would not do that because this kind of concepts are somehow, let's say, forbidden. They do not exist in a libertarian philosophy, where only an individual is prioritized. And why even discuss with libertarians? I think that there are two different reasons. The first reason is that actually a lot of protesters all around the world were referring to individual liberty and try to justify their resistance towards public health measures by this reference to individual liberty. And I think that to some extent, of course, individual liberty is important thing. So we have to check if this is really important. And there are some philosophers, some public health, let's say, theorists who claim that if we have a libertarian justification for certain public health policy, this justification is quite strong, because in most of ethical theories, let's say individual rights, and especially in most of Western liberal democracies, this reference to individual liberty is like a trump card, and it somehow wins the public discussion. So if we have a libertarian justification for wearing a mask, that would be a very good justification, and there is no any instance that someone can appeal to justify his or her own resistance towards this policy. that was our idea, because what I'm going to say is somehow based on the paper that I wrote with Vilius Dranseca, a friend of mine, and this is the possible libertarian justification that we come up with. But when we talk about libertarianism, we have to remember about two different challenges. So the first challenge is the challenge that rises from the problem, or from this junction between individual interest and about the state. So if we want to involve someone and there is this requirement of consent, when there is a disagreement between libertarians in one libertarian state, and they have a completely different conception about what kind of policies are justified by individual liberty and what are not justified by individual liberty, there is this danger that the state will, let's say, fall apart, disintegrate, and we, instead of one libertarian state, we will have 3 or 4 competing libertarian states with completely different public health policies. And also there is this argument which was discussed by Freeman in his paper about illiberal libertarians. So he claims, and that, I think that he gives a very interesting argument, that in its core, libertarian philosophies are not liberal in a traditional sense of this word, because in the liberal democracies we usually have a certain, let's say, let us use a Greek word agora. So we have a special place, a parliament, when we can discuss and form our social consensus in regards to a certain public policies. But a libertarian state actually doesn't have this kind of instruments, and it consists only of private agreement between individual citizens, or between individual citizens and as one of the most influential libertarian puts it, namely Robert Nozick, dominant protective agency. So the government is this dominant protective agency, and you have a deal only with this dominant protective agency, and there is no any other business than protection of your rights and well-being. So if there is any kind of difference between individuals, between citizens about certain things, in a libertarian state, you don't have this place where to, let's say, come up with a consensus or discuss certain problems. So I think that Freeman would argue that the properly political sphere is absent in a libertarian state. So this is a big challenge for libertarians. Another challenge is so-called moral paralysis. Let's say, if I have full ownership over my body, then whatever happens to my body should be because I consented to this kind of intervention. But right now I have an open window because there is no air condition, and we have quite warm weather in Krakow. And when I hear a car or a motorbike, it means that someone, let's say, impacts on my eardrums, and someone is doing something to me without my consent, and it somehow violates my rights. So another danger for a libertarian is this kind of moral paralysis, because in everyday life we usually, let's say, violates other moral space on the regular basis whenever we do something even in our own house when we want to listen to music loudly, we somehow interfere with others' well-being. So another conceptual danger for libertarians is this moral paralysis. I can't do anything without consent, and it's impossible to have consent to do anything from everyone who could be affected. So let us jump to the possible libertarian policies. So let's have a first overview of possible health policies. Then I would like to talk a little bit about mandatory vaccination. Is that justified on based on libertarian principles? Then I would discuss the principle of self-defense, and then I will discuss the concept of room for rights. So let's do this kind of policy overview. So I'm going to discuss different possible policies. So mandatory vaccination, masks, vaccination passports, quarantine, compulsory isolation of infected person, and mandatory testing. So let's jump into mandatory vaccination. So Jessica Flanagan in 2014 published a very interesting article where she discusses analogy between not being vaccinated and shooting indiscriminately into air. And her statement, her claim is that there is a very strong analogy with a person who refuses to be vaccinated and a person who just uses a gun in a very frivolous way that put others at danger. And she says that in most states in United States, if not in all states in United States, and probably in most countries in the world, this kind of frivolous use of a personal weapon is forbidden because it can harm others. So she says if we prohibit using the gun in this way, we also should have prohibition of being unvaccinated. So it means that vaccination should be mandatory. What do you think about this argument? Is convincing for you?
I don't know how convincing it is because at least for most viruses, I guess it would be different if you could spread it outside. But at least with COVID, it seems to be extremely unlikely to spread outside, especially unless you're in a very long conversation with somebody. And if you aren't vaccinated and you're inside of a private business, they have the right to, I guess, check whether or not you've been vaccinated. So unlike firing a rifle, I guess unlike firing a rifle into the air, I think you would consent to be with somebody who's unvaccinated in a private business where they allow people to be unvaccinated, and therefore I don't know how much this makes sense.
So you said that if I understood you correctly, that there is a difference in the probability of harm when we talk about shooting in air and being unvaccinated, and there is also the difference because before we involved in a relationship with person who is possibly unvaccinated, we can consent to that contact. Yes, so if I know that you are unvaccinated, I consent to, let's say, to meet with you. But if you are shooting in my neighborhood into air, I don't have a way to stop you. That was your argument. Yes.
Yes.
I see that Annette Hopkins wants also to say something. Yes, please go ahead.
Yeah, I agree that there's I think there's like a moral distinction between the two, especially when you consider like once a population reaches herd immunity, I don't think that not vaccinating would be as like irresponsible as frivolously using a gun, because there's already that like large population or large percentage of the population that's already vaccinated. So there wouldn't be as much of a risk of an unvaccinated person spreading the virus. But I think in general, up until that point, it would be irresponsible not to vaccinate. But then once you reach that point, I think that there's definitely a difference.
I think that this is a very good point. I will come back to this a little bit later. Still, Maxi, I think that you were first.
I actually would agree more with the analogy. I think that the idea of shooting the gun into the air is more akin to like passing someone on the street and getting infected. If you're in a private business that allows them to be unvaccinated, I guess that'd be like consenting to be in the room with someone who has a gun. And then as for the herd immunity argument, I think that'd be like saying someone in your neighborhood is shooting into the air, but then a majority of the population has bulletproof umbrellas or something. You know what I'm trying to say?
It's very interesting. Yes, Julian?
I don't think this sort of argument would be terribly convincing to a libertarian. I think it because libertarianism has this idea of like aggression and that you're not supposed to start aggression. Let's put it this way. This argument is more akin to whether it's okay to like go outside and potentially infect people when you're unvaccinated, rather than whether you are morally obligated to get vaccinated. Because the vaccine is something that in theory you should have to consent to. The alternative, basically, a libertarian would say, well, if you're unvaccinated, you should inform everyone around you of that, and they can protect themselves as they may. But the government can't like come to your doorstep and say you have to be vaccinated if you haven't done anything to anyone else first.
Yeah, I think that maybe you are right that this analogy goes a little bit too far. That let's say from a libertarian point of view, you can't be coerced to be vaccinated, but you can be coerced to stay at home. Let's say that would be more. So you can have a gun, but you should not use it in a risky way. But there are at least some libertarians who agree with this argument, because I think that Jessica Flanagan, she is really a real libertarian who, for instance, argues for, let's say, self-medication and using drugs, let's say, on your own without the doctor's prescription. I think that Lacey is right now first in line. So maybe Lacey, then Katrina, and Andrew, please.
Hi. So I, again, come from Canada, where we value our liberties, but I have a bit of a different kind of perspective on this concept. Because we have universal healthcare in Canada, which we're very fortunate to have, I feel like there's a bit of a social contract that if you are going to buy into the concept of universal healthcare, you're going to access those things if you break your arm or you get sick from something other than COVID, that you also have a duty in that social contract to vaccinate yourself to, protect the other people around you. So I guess it's shifting more to like a socialist kind of concept or than a straight libertarian concept. But I sort of feel like the government has provided universal healthcare here. And so then the government can't coerce you necessarily they can't enforce vaccination, but I feel like there's a social contract in place where, you recognize that individuals have basic human rights. Part of our basic human rights in Canada is to have healthcare. And so therefore you should participate in allowing other people to have that freedom of that basic right to have access to that healthcare in a way that's safe. So I feel like you kind of, by buying into the universal healthcare, you also should feel compelled to be vaccinated.
Yeah, so this is like more reciprocity argument. So if you get something from the system, you also have to add something to the system.
I was just going to say that the one thing that kind of prevents me from fully accepting the analogy is a person who refuses to vaccinate does so out of either ignorance or misinformation, but like a person who shoots into the air does so on purpose. So I feel like a lot of these people who refuse to vaccinate aren't doing so because they want people to die. They want to infect people with this virus. but someone who's shooting into the air is doing this on purpose. So I think one of the first steps into like removing these shooters, removing these people who refuse to vaccinate is getting them like the right information. So I think that kind of also ties back into something someone was talking about earlier with social media playing a big role into this pandemic. Maybe if more people were, well, firstly removed from like an environment where misinformation is spread, less people would not be vaccinated.
Can I respond to what you said? I think I totally agree with you about the misinformation, especially on social media. It was me who was, I would say, moaning about it in the chat. And you're totally right. People are sharing misinformation. They're reading it. They're not reading it properly. They're not checking the references. They're spreading it around. And then they're very confidently telling other people to agree with them. The problem is when, for example, I have a few people on one of my social media streams who do this. And I haven't unfriended them because I'm trying to do what you're saying and share adequate information and reference that point and try to explain it in a non-clinical way. Is some of these people seem willfully to not want to hear that, and they are holding on to, they have an agenda. Essentially they have that agenda, they hold it, they believe it, and they willfully reject any other information. So I think in some cases you're right, but in others, unfortunately, it isn't right, and those people are willfully refusing and not open to other information sources. Sorry, ranting.
That's true, but this is a little bit different topic. So let's say last voice in this discussion, and we are moving forward. Please, Katrina.
Yes. So I just to update the analogy a little bit, to talk about, to say if it was COVID, we were talking about the virus itself seems to be changing and mutating consistently, and because of that, I wonder about the herd immunity aspect of this and whether or not there truly can be herd immunity, because it seems as though most people around the world need to get vaccinated or we will never be free of this virus. And so that may change this argument a little. If you had a vaccine that you could not develop a herd immunity. I just wanted to add that.
Yeah, I think that in this argument, actually, this concept of herd immunity is very important, and what Jason Brennan thinks is actually it corresponds what Annette said, that according to Brennan, there is no analogy between shooting and going unvaccinated, because let's say not shooting protects individuals, but when mandatory vaccination protects public health. And this is a certain, when we vaccinate ourselves, we do not do it to protect individuals, but we do it in order to protect the whole community and to build this herd immunity. So we are participating in a group action. So this analogy here is not full. And also, when we do not vaccinate ourselves, we also put others at different kind of risk when we shoot into air. So that's why Jason Brennan comes up with his own argument, and he calls the principle that he refers to principle of clean hands. So he says that one should not participate in actions that harm or increase risk of harming others. Like being unvaccinated violates this clean hands principle. And Brennan, of course, argues that his position is justifiable from libertarian perspective. He is also a well-known libertarian who even wrote a book about, even probably more than one, about libertarians. But what is the main problem for Jason Brennan? So usually when we think about risky behaviors, there are plenty of different risky behaviors that we involved on the regular basis. So we, for instance, use cars, we eat meat that produces a lot of pollution, and this pollution contributes to the risk for the whole population. So Brennan has to come up with the distinction between justified risks and unjustified risk, and he uses actually the concept which was elaborated by Hansen, and Hansen says that those activities which pose risk to others are justified, which produce net social benefit. So Brennan, in his article, he uses a very strange thought experiment, maybe not so strange for philosophers who really like abstract and thought experiments. So he compares, let's say, driving cars as a risky activity and setting an explosive device in places where not a lot of people would pass by. So let's say if I drive a car, I put others at risk because I can cause a car crash and I contribute to the air pollution and so on. And this risk could be somehow comparable to setting an explosive device that in a place that not a lot of people appears. So when the device goes off, no one is really hurt, and we can calculate this risk in a similar manner. So these two situations are comparable. And Jason Brennan says that driving a car is justified because driving a car produces a lot of social benefits, and these benefits are actually outweigh the costs. And this cannot be said about setting explosive device, because setting explosive device doesn't produce any kind of social benefits. And the same can be said about being unvaccinated. So when I do not vaccinate myself, I contribute to let's say lowering the level of herd immunity, and I put others at risk. I increase the risk for the whole population, and I don't produce any social benefit. But of course, this argument also is difficult to accept for a very staunch libertarian, and that was pointed out by Justin Bernstein, who also published his paper in Journal of Medical Ethics, and he points out that the clean hands principle actually refers to the greater good, which is forbidden for a libertarian, because this social net benefit is something which we can call common good, and that's why in the libertarian state, mandatory vaccination it's not yet justified. So at least I do not see any arguments that would justify mandatory vaccination from a libertarian point of view. As I don't know who, that was probably Julian, who mentioned that libertarian can justify that you have to stay at home in order not to infect others, but libertarianism cannot justify mandatory vaccination. So let's look at the self-defense principle. And it was Martin Wilkinson who in 2007 published a very interesting paper about public health and self-defense. And he says something like this, like public health intervention can be understood as a form of defense. And in that sense, a state acts like a third party which protects individual. So for instance, if state imposes a mask mandate, it protects me from the actions of people who could be or who are infected in that sense. But Wilkinson underlines the fact that public health, that there is no analogy between public health intervention and self-defense principle. Actually, there is identity between these two actions. So that's why public health intervention is justified only when it meets the same conditions for justified self-defense. And according to Martin Wilkinson, in most countries, the self-defense doctrine, legal doctrine, is that self-defense is justified when we use least restrictive measures, when there is no alternative, when we use measures which are proportional to possible harm. So I would not, let's say, kill someone who just wants to slap me, but I can punch that person. So if I see that someone wants to slap me, I can punch that person, and that would be justified self-defense. But if I shoot that person, that would be unjustified. This is, let's say, this principle of proportionality. And of course, we have to protect ourselves or defend ourselves from the bad outcome, and there is a likelihood of forestalling the threat that is coming. And what Martin Wilkinson says, he says that this kind of okay, before I said what is his conclusion, I also want to mention another important distinction, and this distinction is associated with another very strange thought experiment, that actually originated in Robert Nozick's famous State, Anarchy, and Utopia. And he said that we have to distinguish between threats. So, for instance, a person with a gun who wants to kill me, and someone who is an innocent threat. So someone who could kill me, but not intentionally. And he comes up with a very strange thought experiment. So he says something like that. Let's imagine that you fall into a well. So you are imprisoned into a well. You can look up and you see the stars, even if there's a daylight. And luckily, you are in the well and you have a laser. The laser is needed because some very unlucky person can also miss a step and can also fall down into the well. So you are in the well and you are seeing that someone is falling on your head. And Nozick asked a question: do you have a right to kill that person, to disintegrate the body of this falling person to save your life, to defend yourself? That person is innocent. It's not his intention to kill. And Nozick says, yes, so you have a right to kill even an innocent threat. So killing innocent threat is within the doctrine of self-defense, but it doesn't mean that killing a bystander is so someone who is not associated with the threat. So in a doctrine of self-defense, we don't have a concept of collateral damages. So let's say I want to defend myself, and I just throw a grenade and everything explodes around me. Let's say murderers and also innocent bystanders. So this distinction is quite needed to understand the Wilkinson conclusion. So Wilkinson says that mandatory isolation of someone who is infected is justified by self-defense principle, because we defend ourselves from someone who is a threat to others. So if someone is sick, if someone is a carrier, we put him into the isolation, but we cannot put into a quarantine someone who is just possibly infected, because that person is just a bystander. We don't know if that person is a threat to us. Okay, and this is the place where we comes. I mean, me and Vilius. So we think that this principle of self-defense can be a little bit extended. So we think that self-defense occurs not only when someone is falling on you when you are in a duel, but in a certain context. And in that context, we usually also have an opportunity, and also we have a right to identify if someone is a threat to us, or is just a bystander, or maybe is an even innocent threat. And in that context, we also have a moral right to require that person cooperation with us. And if that person doesn't want to cooperate, we also can, let's say, use some kind of proportional but still defense measure. And in order to prove our point, we use this kind of thought experiments. This is not so sophisticated as Nozick thought experiment, but we say, imagine that you are in a fallen city. So you know that there is, let's say, now no sufficient policy presence. There is a lot of crime on the streets, and even there is a sect that sends suicide bombers all around the city. And you have to do some kind of shopping, or you are, for instance, a police officer, and someone is approaching you, and you can reasonably expect that that person also knows the situation in that city. So in that sense, before you, for instance, fire your gun, you can search that person. You can try to, you can ask that person to identify himself or herself, to show that that person doesn't have any kind of explosive device attached to him or herself. And if we are, if this analogy works, or maybe this is not even analogy, but if self-defense principle can be extended also to this kind of engagement with a possible threat, then it means that it justifies mandatory tests, quarantine of someone who refuses this test. So if for instance, we want to involve in a certain situation, we have to prove that we are not threat to others. Okay, and now I would also like to ask you for some comments. What do you think? Is this argument convincing?
I have a question for you, Dr. Piasecki.
Yes, please go ahead.
From this perspective, how would an individual feel about contact tracing? So if you were diagnosed with COVID, for example, and the public health unit wanted to contact trace and identify all the individuals you've been in contact during your infection period, what would the perspective be?
And that's very interesting question. I think that I have to let's say put a little bit more thoughts into that. But I think that let's say my first like gut feeling is that you can justify it, because this is also this kind of activity that protects others from this threat. Yeah, I think, but I would have to analyze it a little bit more closely, and that's what I can say. Let's say, like, in a quick way. Yeah. I think that it could be somehow compared to contact tracing could be compared to searching for a suspect, for someone who is so suspected to commit a crime and to be a threat, but still is not proven guilty. Yeah, that maybe this analogy could be stretched like this. Okay, if there is no other questions, we can go to another idea, and to the elbow for rooms. I have to in advance. I have to admit that this argument is a little bit, in my perspective, a little bit weaker, but also because the libertarian concepts are weaker here. So we already talked about this moral paralysis that is possible in a libertarian state, because we have to we are required to have a consent if we want to interact with others. So what to do in order to avoid this kind of moral paralysis? And Robert Nozick, in his famous book, discusses two different moral principles. Actually, there are some interpretations that he accepts only the second one, compensate for prohibitions, but there are interpretative, let's say, arguments I'm not going to discuss. So the first idea is that in this quite benign cases, we can just cross each other boundaries, and when someone wants to be compensated, we just compensate them. So if you want to throw a party, you just throw a party, and when you cross someone's boundaries and someone's rights are violated, you just come to that person and say, okay, this is $100. I hope everything is all right now. And the second idea is that actually a state has a right to prohibit certain activities, but then the state has to pay this person who is prohibited from abstaining from action. So let's see how we can actually justify this or analyze these two principles. So the first principle, cross and compensate, probably cannot be really justified by libertarians, because if there is no consent, a person is treated merely as a means. So we violate the moral rights of that person. So even if we pay them, that person, a certain amount of money, this is not enough, because we cannot really pay moral damages. Of course, in the real world we can, but in a moral sense, money will never buy moral damages, and from the moral perspective, we just cannot accept it. What about compensate for prohibition? So Nozick argues that this is defensive principle, and we do not, that's why the concept is not required, because we don't have to, let's say, ask for consent of our attacker to defend ourselves. So we just defend ourselves, and then we compensate for this prohibition. But as Sina Eftekari points out in his paper, also very interesting paper, this principle is a little bit too broad, because then let's say it would involve state in too many different activities, in compensating too many different individuals for too many different things. And this kind of very active and involved in compensation state is probably not the state, is not probably a minimal state that would be accepted by a true libertarian. So probably libertarian also would not accept this compensate for prohibition principle. So then, luckily for libertarians, is a proposal which was put forward by Eric Mack in 2015 in a very interesting paper. So he actually alludes to a legal precedent in U.S. law, and he comes up with the concept of room for rights. So he says that self-ownership has actually this two aspects: a negative aspect and a positive aspect. I have a right to be left alone and not to be my space cannot be violated by others. But on the other hand, I also have a right to live my life. So do whatever I would like to do in my everyday activities. So I can drive a car, I can listen to music, I can have a grill outside, or I can sing a song when I go to work, and I don't really have to think that I violate someone's rights, because other people also have right to live their own life. So we are just living in a world where we give ourselves and we give others some space for expressing our own freedom. So, and we cross each other boundaries, but we don't really care about this. And what Mark says is that this elbow room for rights is something conventional. So there is not a priori measure. So how much space we need. So we know how much space we need because we observe ourselves and we somehow implicitly negotiate this space for ourselves. And probably in different cultures, this personal spaces are different. Probably that was this kind of a meme from Finland and pandemic. So how people are distributed on the bus stop in Finland before the pandemic. So there were in a like more than 2 meters distance one from another, even before the pandemic, because they need conventionally, they need much more space that, let's say, people in metro in Tokyo, where they accept that they are squeezed one against another. And here also is our idea that this concept of elbow room for rights depends not only on let's say conventions, depends on circumstances, and has something to do with our well-being and with our everyday goals. And this room for our rights can shrink, and this convention is changed. So if you live in a bungalow, or if you live in a separate house which is far away from other houses in the woods, you can allow yourself for much more, let's say, personal space and expression of yourselves. And social convention is completely different than if you live in a tiny block apartment with a very thin ceiling, and you can hear and produce voice that is heard by your neighbor upstairs or downstairs. So if this is true, if we have different conventions and these conventions are somehow justified by our well-being and other social circumstances, also probably pandemic is this kind of event that changes our social conventions. And actually pandemic makes that room for our rights is shrinking, and expression of our rights is less possible. And in that context, we have to also stay at distance from each other, and we have to keep our droplets for ourselves. So when there are normal circumstances, I don't care. I can breathe a lot of droplets which are produced by people who are in the same room with me. But when there is pandemic, I'm not so eager to really inhale what they exhale. So that's why we accept this social convention of a mask, and this is not arbitrary convention. This convention, as I said, has something to do with our well-being. And one of possible argument is that okay, but this argument also refers somehow to the well-being of the whole society or greater good. But this is not the case, because the goal is not what the policy or not the convention produces, but this is just the fact that the convention changes because of our individual preferences and our individual well-being. So let's say conceptually or logically, the convention is first, and this is justification for the mask or social distancing, not the fact that diseases would spread in a certain community. Okay, so the conclusion and a few minutes for a short discussion. So a libertarian can endorse some public policies. This is, of course, my point of view. I hope that this is sufficiently justified, that self-defense principle justifies mandatory test or quarantine and isolation, and shrinking room for rights and change social convention justifies mask and social distance. Okay, guys, I think that we have, let's say, 5 minutes for discussion. Then I would propose to have 4 minutes of break and we can jump to another topic. So 5 minutes discussion starts right now. Yes, Akari?
Thank you. So with the self-defense or maybe identifying a threat analogy, please correct me if I'm wrong, but I noticed that it brings the attention away from social contract and more of a contract on an individual basis. So would viewing things like mandatory tests or quarantine as means to completing like those one-on-one contracts, would that align more with libertarian values?
I think that this is a very good question. Of course, here a state works, let's say, for me as a third party, which is a representative, because let's say when I when I want to fly somewhere and I appear at the airport, I as an individual citizen, I don't have any power, I don't have any means to, let's say, force another person to present himself or herself with a test for COVID-19. So that's why I'm using a more powerful person, a more powerful third party, in that case, state. And this state is involved because somehow I ask the state for involvement. And involvement of the state is justified because state acts in protection of my individual rights. State doesn't care about, let's say, spreading the disease in a certain population, but it acts because some people in the states wants to be protected by this policy. Does it answer your question? Is that satisfactory?
Thank you.
Yeah, Julian, I think that you are next.
Yeah, this might be a bit of a sort of throw from left field, but I do think it's interesting the focus on the idea that public health needs to be protected by like mandates or by state action, because the communities that have really most ignored and suffered from ignoring the mandates, a lot of the time, you know, those of us who disagree strongly with them have a tendency to view those people as very individually selfish for valuing their right to not wear a mask over infecting their neighbors. And like maybe they are, but at the same time, I also see the whole when the whole community acts in that way, I see it as a sort of civil disobedience, as a sort of collective action. And I think it's really interesting that sort of because those people take the discourse as starting from this is something the state is forcing upon me, the collective action becomes collective action against the state and against mandates. When, as I see it, like that's a very organized community, and an organized community is a very valuable thing. And I don't know, maybe this is more of a practical question than a philosophy one, but you know, had we started from like, let's engage the community and let's use that organization to convince people like for each other, because clearly they do value like other people's freedom because they're doing this sort of collective action for mutual preservation of freedoms. I don't know where I'm going with this. Maybe I'm rambling, but I just think the conversation doesn't need to start with justifying a mandate. It can start with like a different mode of public health that might be more amenable to a libertarian perspective.
I think that this is a very, very interesting question, and I would like to say two things. The first thing is that I already mentioned that every libertarian state is a danger of fragmentation. So if there is not enough individuals who wants to endorse a certain protective policy, then probably the state will divide into two different competing states that are actually, let's say, climbing the same terrain. And this is always the risk. And as you say, there is some kind of ethical value and ethical importance in this kind of civil disobedience and organized action. But another thing is what has to be stressed here is that this kind of organized action probably is not in the name of freedom per se. So, because if you are concerned about your own freedom, then you are also obliged to be concerned of others' freedom and others' safety. Yes. So I maybe disagree myself that let's say I really would like, let's say, to use my gun frivolously, but I really don't want to hurt anyone. So that's why I limit myself, because I think that someone's health and someone's life is much more important than my pleasure from using my gun. But what you are referring to is probably that some people are less concerned about freedom, but they are much more concerned with their way of life. And they say, okay, let's protect our traditional way of life as a group. And traditionally, we don't wear masks. Traditionally, we don't do any tests. Traditionally, and the way of life that we have, we call this, let's say, a free way of life. So in a sense, they use a concept of freedom in a different context. So they protect their freedom, but they don't care about freedom in general. They protect about their own way of life. And this is something different. Because when you are truly libertarian, you don't protect your own way of life, but you protect the principle, a moral principle. So let's say a Nozick is a very deontological, very Kantian philosopher. He is concerned about individuals. And those people who organize themselves, they're rather concerned about their own way of life. Of course, this is still morally important, but this is a discourse on which uses a different concept, and they use the concept. They use the word of liberty and freedom in a different sense that libertarian would use. Any other question or comment? Alisa, I think, and then Annette, please.
Yeah, so I live in the United States, and I think obviously like there's one population that is vocally against any form of mandates like social distancing, wearing masks, etc. But I think another like part of the population like obviously like wears masks and does all they can really to follow mandates, but just they sometimes can't for like economic reasons, because they still need to like go into work, so they can't really quarantine, or they don't have access to mandatory tests because in the United States most of the times you do have to pay for them unless they're offered through like some private company. Like my school offered them, but I also pay to go to school in some sense. So what role does the state have then? Because it's not necessarily that people aren't or choosing to not follow these mandates, or are using their personal liberties to not do it. It's just that they can't really do it. So like, does the state have some kind of obligation to offer that so that people can exercise their personal liberties? Or like, I just don't know how that works.
Yeah, I think that this is also a very interesting question. Let's say if we don't necessarily want to put this question into libertarian terms or libertarian frames, I would say that, of course, if state requires something, that also state is required to provide individuals with possibility to follow certain policies. In a libertarian state, probably that would be a little bit more complicated, and how actually this kind of protection would be, let's say, deployed or redistributed. I would have to think about this a little bit longer to give a more definite question. But let's say the general question, which doesn't care too much about libertarian correctness, if I use this words, would say that if you if you make something mandatory, then you have to provide a person with a test, especially if that person cannot afford something like that. How it would look like in the libertarian state, and especially when we refer to self-defense, that probably be a little bit more complicated, but probably also even in the libertarian state, because as Nozick says, in terms of defense, even a minimal libertarian state is redistributive. Annette?
Yeah, you mentioned how a libertarian could endorse public policies like shrinking room for rights in case of an extreme situation like a pandemic. And I was wondering how they would value rights such as like privacy in regards to like your vaccination status in a pandemic, because I know that's coming up more now, where you need to show proof of vaccination. But that also is like, you know, it's like a part of a medical record. It's like people also have a right to privacy. So how do you think a libertarian would balance those two?
That's a difficult question. I thought about this, and initially I thought that it would be justified by this extended right to self-defense, and that you have to know that you have a right to know a status or infectious status with someone who is traveling with you. But I don't know if it is because, let's say, but vaccination passports actually they work a little bit differently, because they don't sort actually people who are actual real threats, but they use a proxy of a passport and of the vaccination. So I would think that it would be a little bit more difficult to justify it based on libertarian principles. And even in that case, when we stick to libertarian principles, they should be treated equal to testing or to long time self-isolation. So I don't see how we can argue that only this proxy for not being a threat could be treated as the only policy. Yeah, Maxi?
So I live in America, and here I was just wondering, like, what are your thoughts on like the role of the government in helping create the vaccines? Because all of the vaccines are made by private companies, of course, but they would not have been possible without significant like government intervention and a lot of funding. It's like, I mean, the way that I would defend it would of course be like it's in the public good, but then that wouldn't help. So like, what are your thoughts?
Okay. I'm not. I didn't say it probably quite clearly. I'm not libertarian myself. I'm rather consider myself more liberal in an even American sense. But I think that it would be very difficult to justify this kind of state involvement based on libertarian principles, because generally that would libertarians praise free market, and this kind of involvement is distortion of the free market economy, and there is a form of redistribution of goods. So I think that a true libertarian would not agree for this kind of intervention. Although I think myself, as a person who identifies himself as a liberal, that this kind of involvement, of course, is justified, and we can. I allow myself. I accept myself arguments which refer to the greater good or to the common good.